Welcome to Shift. We are excited today to have Steve Horsfield from Simpson Housing. And we had asked Steve to come back when COVID started. He got a little bit busy. Simpson Housing is located in Minneapolis and has been around since 1982. We'll get into that, but first I want to ask you about how the housing business has been for the homeless.
Yeah, certainly in light of the pandemic, our work has grown much more challenging. We operate a shelter. We've been operating a shelter. That's our legacy program since the winter of 1981-82. For 40 years, we started as a ministry of the Methodist Church there at Simpson United Methodist Church at 28th Street and 1st Avenue South.
We love the Methodists, by the way. Hello, Methodists.
And what happened recently is that we had actually expanded a little bit over this winter because there had been some statewide attention. The governor's office had brought some attention, and there had been some private support. And so we had expanded our typical shelter operation from about 70 beds to about 90 beds back in January, February. And then when the pandemic hit, we got very nervous about operating in a congregate setting and keeping people safe. If you imagine, we've got a women's restroom on one side of our shelter operation and a men's restroom on the other side. So in the men's case, we've got 45 men coming and going from one restroom area. So the concept of social distancing is really rather absurd in that sort of setting. So it got challenging. We were able to begin to work. Thank goodness the Hennepin County officials worked with us, and we were able to proactively move about 30 folks from our shelter out into a hotel setting, and these were folks that were the most medically vulnerable and elderly. So thanks to some county resources, we did that, and we ultimately got our head count down to about 40 individuals, which we feel is a safe and responsible level for us to be able to operate in with COVID-19. The other very unfortunate thing is that one of the real highlights of our shelter program is the meal service, which is mostly churches coming in every night of the year, bringing the ingredients and doing a lovely home-cooked dinner. Well, we had to cut off all of our volunteer engagements in the shelter setting because it was just too much risk with the potential for coronavirus infection. And so, unfortunately, we were able to partner with a couple of local vendors within the neighborhood in South Minneapolis that are doing very low-cost catering options for us for breakfast and lunch and dinner. And the other major impact to the shelter operation is that we went immediately to a 24/7 setting, whereas typically our shelter would close at 9 a.m. and reopen at 5 p.m. each day. Well, as soon as we started to realize what a solution to a potential solution to COVID-19 was going to be, and we are hearing from local officials about stay at home, that's all well and good if you have a home. And so being sensitive to that need for our folks, we wanted to make sure that they did not have to go out and put themselves in risky situations every day if they did not need to be out in community. So we extended our operations to remain open all day long.
Which is increased cost for you.
Which is increased cost for us at a very significant level, yes.
And so how are you coping with that?
Well, fortunately, the community has really stepped up. I mean, specifically the cost question?
Yes.
Yes. Fortunately, the community has really stepped up. So all of those, I shouldn't say all, many of those meal groups, they are very aware of these implications. And so rather than sending volunteers and bringing food in, they have been supporting us financially to help cover some of the food costs. A lot of folks simply are well aware of the implications of what it might mean in a pandemic for people to be without homes, and so they've responded very well to our appeals. We've got a couple of foundations, a couple of good partners in the community that have really stepped up and helped with some matching gifts to engage more community support. So far so good. We've been able to continue to make ends meet with increased costs.
So sort of keeping afloat.
Exactly.
How is your staff?
Yeah, the staffing has been the real question. Of course, we wanted to be respectful of staff, and so folks who have immunocompromised members in their household or young children in their households, we wanted to make sure that they were not in a position where they had to come to work. So we were able to work with those folks to reassign them or to allow them to take time away from work. And fortunately, with the reduction in overall residents, guests in our
Yes.
shelter each night, we've been able to maintain our staffing level in an appropriate way, and we only have had one positive test amongst staff, and that person actually worked part-time for us and part-time for another agency, and we were able to catch that immediately, and it did not result in any spread within the shelter. So our staff, most importantly, our staff has been able to stay healthy.
That is great.
Yes.
What about the Hennepin County situation where they moved to Hennepin County hotel, or
Yeah. So
who's manning that?
yeah. So when the very first week and weekend that the county started into their first hotel, we actually had Simpson staff on site providing supervision at that hotel through the first week. Fortunately, county staff, the county has a whole lot of people that work in public settings, libraries,
Right.
And all sorts of things that are currently, or at least in the beginning, were not operating. So they were able to reassign staff from all across human services and other departments of the county to go in and operate to staff the hotels, and that continues to be the case, thank goodness. So our staff, we filled in when the county needed some help initially, but then we were able to back away and resume taking care of our shelter staff, or our shelter guests, and the county themselves have been able to staff those hotels where we've got the folks that are elderly and at risk.
How are you dealing with COVID in terms of, are you masking, are you sanitizing?
Yes, we've been just doing what everyone else is doing, frankly, which is really paying close attention to the Department of Health and CDC guidelines. Initially, the guidance was we did not want to. No one thought it was a good idea for us to be masking healthy people, quote unquote, and obviously that has that we've turned a corner on that. So now our staff are all 100% masked. We ask that our guests wear a mask, but I mean, as you can imagine, I don't wear a mask in my home. I don't know about you, so it's not.
That would be no.
So it's not something that we enforce rigidly amongst our guests. If they want to be able to relax and watch television or lay in their bed and not have a mask on, they should be able to do so. But we are, all of our staff are masked. We brought in extra hand washing stations. Obviously, we've got hand sanitizer and all of that sort of stuff. Our meal service, unfortunately for the environment, has gone to a completely disposable practice. So we have a masked, gloved shelter attendant who is handing a plate of food to the guest. That's a paper plate with plastic silverware and all of those things, so that when they're done eating, that all just goes in the trash. So unfortunately, we're generating more landfill during this period, but we have put into place practices that allow us to be able to serve food, serve our guests, and interact with one another in ways that are at the lowest possible risk level for virus spread.
Mental health is a huge thing for all of us right now, and imagine being homeless, having that burden, and then the situation that we're in. How are people doing?
Yeah, so it's been interesting to observe. In some ways, initially, our guests, I mean, they're facing all sorts of pressures anyway. So this was just sort of like one more thing. So the initial feedback from guests was they weren't feeling terribly impacted by it. As time has gone on, with under normal circumstances, a third of our shelter guests are working. That's how it is day in, day out, month in, month out, year in, year out, up till now. Obviously, a lot of those jobs, food service and the like, people were not able to do that. So reduced activities outside of shelter, and just the general sort of suppression of community engagement in various ways has definitely taken a toll. We have offered and we have brought in some services to our guests to allow for some daytime activities and to encourage a little bit of positive interaction and those sorts of things, and making use of that time where we can. We still find that a good chunk of our guests are out during the day, either working or attending to the business of life, or tending to family, or whatever that may be. So, so far so good. We've got some good relationships with some mental health professionals that provide some support to our staff to make sure that everyone is practicing good self-care. We've got a wonderful program management structure that really practices excellent social work practice, and so making sure that our staff are feeling supported and have the opportunity to process and have the opportunity to step away and care for themselves on a regular basis has been absolutely vital. One of the things that's really one of the unforeseen consequences from my view about this is just recently, no one can take vacations. I mean, you can't go anywhere. So, that notion of being able to take time away from work and go and recharge and rejuvenate and all of that sort of stuff, I mean, really, that's been happening not at all effectively for the months of for the months of March and April and now May. So that's really unfortunate. And so we're really working with our staff now to encourage them as things are starting to open up, as they can go and camp and go and be places. We're trying to encourage folks now to start planning vacations, working with our supervisors to get folks out of the office, go relax, go do something else, and so that you can be in good health to take care of yourself and our guests.
That's a great idea. I think sometimes we don't realize, what this has done just to our sort of psyche and our well-being. I have a question here from Jerry Paulson, who's one of our sturdy volunteers, sturdy. He's wondering about the status of fundraising for the new building.
Yes. Really what I can say about that at this point is that we have it's going to be a large project, and we have a significant public funding component to that. And we have a bill in front of the legislature that ties into bonding. When we began, as we were doing strategy work and planning, and at the very beginning of the session, we were actually thinking that this was going to be a good year because we had a state surplus in the budget.
Right.
Since then, we have burned up the surplus and lots of other resources responding to the pandemic. And ultimately, the legislature was not successful in passing any bonding bill prior to at the end of the regular session. They're coming back with a special session in June. So we are working with our legislators to get something passed when they come back to the special session, and that really will. We've had some preliminary gifts from Hennepin County and from institutional funders, but that state component is really vital in terms of kicking off the next wave of fundraising. So. We're looking forward to working with the state to get that done one way or another here in June.
Yes, things are not what they were, and we're all trying to adjust and accommodate. So sometimes those big dreams have to just be altered.
Yes.
Is there any plans for a temporary shelter location while they are building, or is that too far out?
That's too far out. So we are committed to not having any interruption in services. Yeah. That is for certain. We have begun to have some preliminary conversations with a couple of potential sites, but frankly, when we're talking about construction beginning probably in, well, let's put it this way. When we get within a year of the construction date, that's when we need to get serious about that location.
We'll let you know.
Yes, exactly.
That's right. So the shelter started in the Methodist Church, which is sort of a grand old building, back at, you said, in 81, 82. What is the story of Simpson Housing?
Yeah, so the winter of 1981-82 was a difficult time in Minneapolis. There were more people suddenly sleeping outside. It had to do with a lot of things. There was a federal deinvestment in public housing billions and billions of dollars that the federal government was no longer spending on public housing that year. There was a crack epidemic was starting to raise its head, and locally there was the third wave of some very significant waves of gentrification to downtown buildings had just taken place with the building of the convention center, and that took out a lot of units of what had been rooming house.
Right, just on the edge of downtown.
Exactly.
Yeah.
So more and more people sleeping outside. The way the story goes is that the good folks at Simpson United Methodist Church, they show up on a Sunday morning. They say, "My goodness, we got all these people sleeping outside. We got to do something." The men say, "Well, we're going to go down to City Hall and talk to the mayor's office about what can be done."
Mayor Fraser at that time, right?
At that time,
yeah.
yep. And the way the story goes is that off they went, and by the time that they got back, the women of the Methodist Church had already opened the doors, got folks in. Everyone was sleeping, and they were baking hot dish. So I don't know how much of that is urban legend, but that's the if you know anything about Methodist women, it's probably not far from the truth, because they are a force to be reckoned with.
It sounds like Lutheran women.
Yes.
They put their mind to something, they're like, gone.
Exactly. So that was our genesis in that winter. We continued to operate as a ministry of that church for nearly 10 years. In the early 90s, we spun off as a private 501c3, and really that was because we were getting into more and more housing work in addition to the shelter that was getting more complicated in terms of funding. And interestingly enough, now shelter is our smallest program. So it's very much our legacy. It's certainly a center point in terms of how we are perceived in the community. But we've got over 500 units where we're providing support services to formerly homeless households across the metro now. So we've got a lot of folks who have had to pivot during this coronavirus pandemic, to spend a lot more time on the phone and on computers and dropping things off on people's front steps, and doing tutoring with kids in these families over Zoom and so forth. A lot of tweaking of services, but we've got about 300 families where we're providing support services that are formerly homeless and getting them stabilized back in community, and that work geographically goes from Carver County all the way across the metro into St. Paul. So very wide swath of our metro area. And what's great about it is that most of it is scattered site housing. So we work with a network of about 300 landlords. So we take a family out of the Hennepin County shelter system, get them placed into housing someplace where they've got some connections and they feel some history or some connection to community, work with them to get them stabilized over a period of about 2 years. They're stabilized. Once they're independent, we're able to step away and go take the next family. And those folks are, homelessness has been solved for that family. They are stable, back in community where we want them to be.
Right, and it's just staying there and
Yep.
growing. Do you work with partners like Habitat?
Oh, goodness. Habitat, not so much, because they're on the homeownership side. So we do have some wonderful stories where people come through our programs, get stabilized, end up becoming Habitat homeowners. We've actually got a board member who that was her path. That's fabulous. But our partners are more on the affordable housing developer side. So we partner with Beacon Interfaith Housing on a couple of projects. We partner with Aon and Common Bond Communities are some of our bigger, and Project for Pride and Living are some of our bigger partners around the metro.
So really, it's shelter, but the idea, of course, is to get people into housing.
Well, and that's actually you mentioned the project, and that's really the thrust of what we're doing there is so we started in 81, 82, spun off as a 501c3, began to continually build upon this housing work, and really all of our investments since the inception of the agency, all of the growth and investment has been in this what I generally refer to kind of as the permanent solution side of things, of getting people into housing. So the thrust of the project really is twofold. On the real estate side, what happened was that the church is no longer functioning, no longer worshiping at that site, and they decided that their legacy would be to donate the property to Simpson Housing Services, and for us to carry forward that legacy of community engagement and social justice that they've had at that corner for 100 years. So it's quite a charge for us to take that on. on the property side of things.
Which was terrific.
It was absolutely terrific. It was an amazing gift, and we're grateful, and we certainly enjoy deep partnerships with all faith organizations of all sorts at this point.
And it's a cool old building too, I must say. I know taking care of a building is not easy in that age.
Yeah,
but it's got some neat things.
It does, and we're looking forward to being able to preserve some of those things in our project and see some of those things go off to new sites. On the mission side of things, what that opportunity gave us was, I mean, for God's sakes, if those Methodist women had known, that we were still going to be doing this work 40 years ago, we might have been a little bit more intentional about space design, because we're still operating with bunks in the gymnasium. So to be able to go to a situation where we've got purpose-designed space that is above ground, not in the basement, natural light and windows.
Hey.
People seem to like that,
Yes.
as far as space design is concerned. So, so restoring bringing some more dignity to this temporary crisis housing model is the first thing. The second thing is that all of our design work is really focused on one thing, and that's moving people through there and out as quickly as possible into stable housing. Yeah. We already house as many as 150 people a year out of our shelter, and that's being closed from 9 a.m. to 5 p.m. So that's this nighttime operations.
Right.
So our new model calls for 24/7 operation, calls for us to continue that work during the workday. So we think we can do significantly better in terms of housing placement outcomes than we're already seeing. So we're looking for north of 200 folks a year placed out of this shelter, which really means that we can move more people through our shelter system back into stable housing faster, which is ultimately what we're trying to do is solve homelessness for more folks.
So do you think there's a difference between the person who started out in the shelter in the early 80s, the average, and the average homeless person now?
The experience is yes. So I think that there's always been a little bit of a churn, especially around metro areas. You get people whom, they are working day labor or working some sort of job where they get injured and there's some sort of crisis and things like that. So there's always people kind of coming and going from housing, and there's always going to be a need for a crisis response at some level. Hopefully, only about 10% of what we're doing right now. What's different now is that we have got a legacy of failed safety net systems in our communities. They closed state hospitals in the 80s, which they certainly should have done. There was some terrible things happening in some of those facilities, but the community safety net of services was never built. There was a conceptual plan for community neighborhood house sort of organizations that were going to support folks, and it didn't arrive. So we've got a lot of folks that get discharged, or that 30 years ago, 40 years ago would be in some place where they'd be receiving proper care, who otherwise now are winding up in our shelters. So the homeless response system, if you will, has become sort of a catch-all for failures in mental health systems, in physical health systems sometimes, where people are being discharged from surgeries and from operations to the street or to our shelters. Corrections, there is not enough good housing work happening at the tail end of corrections engagements that ends up bringing a lot of people into homelessness. So all of those things, along with the trends that we have in our society, which exacerbate some of these things or are exacerbated by homelessness, which include substance use and mental health, expanding mental health crises. So yeah, I think the picture is a little bit different than what it was, and the sheer numbers of it are really what's alarming for us. On the numbers point, what's really disturbing is that the number of folks, if we've got 10,000 people across the state right now that are experiencing housing instability, which is about where we're at, so folks that don't have, they're either in shelter or sleeping someplace not intended for human habitation, we've got infinitely more folks that are in housing but are on the bubble. Right. They're what we call housing burden, so they're paying 50% or more of their income towards housing each month. So a couple of missed paychecks, some sort of crisis, and they're coming in to these systems seeking services because housing is unstable.
Wow.
Yes.
You're advocates as well. You typically have a march. I believe you did it virtual this year?
No. Our annual homeless
Or is it
memorial.
coming up?
So we do it at Christmas time.
Okay,
So,
good. So
yeah.
you're probably still on.
Yes. Let's hope so. What was different this year was it was the first year that we were not at Simpson.
Okay.
We had some issues with the building once the church stopped worshiping in our sanctuary, and so we ultimately had to move it down the street to Plymouth Congregational Church at Nicollet and Franklin, and we had a wonderful service. It was the 35th annual, so we've been doing this for 35 years. The Thursday before Christmas Eve, doing a homeless memorial march and service where we remember all the folks that have passed away homeless or formerly homeless in the previous year. And so we honored about 175 people last year at the memorial march, and you can look for information about that. That will come out towards the end of the year via Facebook and our email and so forth. But it is the Thursday before Christmas Eve.
I do remember that now. I think Jill Cornell and Sue Vickerman went and were very moved. I would like to go.
It is a profound evening, yes.
Yeah, 10,000 is a lot. So I want to bring this to a close, but is there anything that we can do?
Yeah, I would say, first of all, be educated on the issues. It's very easy to think about people who are experiencing homelessness as a different sort of person, or those people, or whatever the case may be. When we talked about what it looks like today versus what it was like many years ago, there are a lot of people who are a couple of paychecks away or a crisis away from being unstable in housing. And I've had conversations with women in our shelter program that had been housewives in Edina for years, and then messy divorce, chemical dependency, things. Another gentleman that I've met and known for years out of our shelter, who now is in some subsidized housing in South Minneapolis. He was a successful architect, had a full career. Major family breakdown, late life onset mental health crisis, and the wheels came off. So. One of the beautiful things when we're able to be together again about our meal service at the church is that it allows people to come in, be with our guests, break bread, and really make that human connection. And that is really, that I think probably speaks to a lot of where we might be needing to do better in our communities these days, is making that human connection. So please look for those opportunities to volunteer with us or other organizations. Get connected with folks. We certainly are very excited about our new project and about investing in this. And we think we've got something that will ultimately be a new national best practice for how crisis housing ought to be done when people are experiencing homelessness. So join us in that as that information becomes available, and continue to support our work.
Thank you, Steve Horsfield, passionate executive director of Simpson Housing, and we support you, and we will do our best to keep apprised and look forward to the day that we can go back and serve.
Thank you so much.